The International Network for Cancer Treatment and Research, or INCTR, is an international, non-governmental, not-for-profit organization that was created in 1998 in conformity with Belgian law. The establishment of the organization was made possible by the support of the National Cancer Institute, and it initiated its activities with an inaugural meeting which took place in November of 1999. In April of 2000, the organization opened its offices in what was then the Institut Pasteur of Brussels, and these offices have since become the headquarters of the INCTR consortium of legally established NGOs in various countries across the world. This slide shows the reason for our existence. You can see that the World Health Organization estimated some time ago that in 2010 cancer would become the leading cause of death in the world. In 2008, 13.6% of global deaths were due to cancer, and approximately 70% of these occurred in the low and middle income countries. By 2030, the WHO has projected that there will be some 13 million cancer deaths, approximately double the figure of 7.6 million in 2008. Cancers and other NCDs are bound to have a negative impact on the global economy. Yet even in the poorest of countries, some cancers can be prevented, others effectively treated and even cured, and all can be palliated. So INCTR's goal is to build capacity for cancer prevention, treatment, research, and of course for palliative care. And to do this particularly in the developing countries with a heavy focus on cancers of women and children. In the 12 years that have elapsed since the INCTR was founded, it's increased in size quite markedly, and today constitutes a consortium of some 10 NGOs which are considered to be branches of the parent organization in Brussels. It also has 12 programs, each of which undertake projects in different areas of cancer control, although of course several of the programs interdigitate, such as pediatric and adult oncology, pathology and palliative care. These projects have helped tens of thousands of patients and their families and provided training of one kind or another for hundreds of health professionals. The goals and mission of the organization are shown here. They are to build capacity for cancer prevention, early detection, diagnosis, treatment and palliative care, to educate policymakers, care providers and the public to ensure healthier lifestyles, better access to health services and the ability to monitor improvements, and to assist countries to conduct research leading to a locally relevant evidence base and sustainable progress. This slide shows women registering for cervical cancer screening in Africa. Approximately 80% of all cervical cancer occurs in the low and middle income countries, but the premalignant lesions can be detected quite easily after several weeks of training of nursing staff and dealt with by a simple technique. In the countries which have the highest incidence of cervical cancer, perhaps 5% of women will develop this disease during their lifetime. These are the strategies that INCTR uses for improving cancer control. Firstly, evaluating the needs and formulating relevant projects. Conducting foundational programs, which includes encouraging an evidence-based approach to health interventions and developing training and education programs, including e-learning, for all health providers and for the public. Creating centers of competence that provide health services, the documentation of outcomes of interventions, and the formation of regional networks involving all levels of care, and collaborating on long-term projects that serve as demonstration projects and provide information about feasibility and cost, provide hands-on training, and can be upscaled if successful. This is an example of a long-term project in which the intent is to educate the public about the early signs of retinoblastoma and eye disease. This particular program is ongoing in Brazil. It's very important, of course, to detect cancer as early as possible if one wishes to have a chance of curing it. INCTR's primary modus operandi is to work directly with organizations and institutions in developing countries. Those with whom we are actually conducting projects we refer to as collaborating units, and you can see a rather long list of such collaborating units in Latin America, Africa and Asia on this slide. Now, by definition, countries with limited resources have too few institutions to care for the number of patients with cancer that there are in the country. So the result is overcrowding of the few institutions, poor access to care, a tendency for patients to present with very advanced cancers, resulting in fewer therapeutic options and significantly worse survival rates. INCTR, of course, does have many partners. We're in official relations with the World Health Organization, and we're a partner of the International Atomic Energy Agency's PACT program, as well as the International Union for Cancer Control and the European School of Oncology. We do have, of course, many corporate partners too, and these are shown on this slide. Many of them are part of the pharmaceutical industry or related to informatics. This is an area that we're very interested in from the perspective of e-learning and other methods of making information available through the internet. This picture, showing some of our palliative care specialists performing ward rounds with their colleagues in Nepal, illustrates the fact that we are very much a hands-on organization, providing education and training as much as possible in the local context, that is, the circumstances in which the individuals who are trained actually work. On this slide you can see a list of some of our many projects going on in various different parts of the world. This picture again shows the gross overcrowding that results from the lack of resources for specialized cancer care in many developing countries. This is the Ocean Road Cancer Institute Children's Ward before it was transferred to Muhimbili Hospital. We hope to ameliorate this situation by training and education, working with local universities, for example, to establish degree courses in childhood cancer or cancer nursing, and to train a variety of healthcare professionals, as well as to build up the research infrastructure. Nevertheless, in spite of the lack of expertise in childhood cancer in Tanzania, as in essentially all other equatorial African countries, we can sometimes achieve quite a lot with very little. Here is a little girl with Burkitt's lymphoma. You can see the huge jaw tumor, and just 3 weeks later it's essentially disappeared. She stands a very good chance of being cured, and at the present time we're curing more than 60% of children with Burkitt's lymphoma in equatorial Africa. Ultimately, of course, it's all about partnerships and collaborations, working together to improve the capacity of countries with limited resources in order that the preventable is prevented, the curable cured, and when anti-cancer treatment has been exhausted, that patients have access to opioids such that in the terminal phases of their disease they remain pain-free and receive the necessary support to allow them to exit this life with dignity wherever they may be in the world. Thank you for your attention.